Hello, everybody. My name is Marilyn Francis, and I'm with the Primary Care, Patient-Centered Primary Care Collaborative Support and Alignment Network. And thank you so much for joining our webinar today, Peer Support, Enhancing Care for Patients and Their Families. You're going to see a wonderful presentation today. The Institute for Patient and Family-Centered Care will be presenting some really interesting and very informative information for us today. Again, thank you for joining us, but let me go over some housekeeping for you. Sorry, my slide isn't quite going. Okay, so as I say, before we begin, I just wanted to let you know that the recording will be available after this presentation, and please participate in the conversation. If you have comments or anything, please add them to our chat box. And also, if you have questions that you'd like our panelists to answer for you, please submit your questions at any time. And at the end, we will have a Q&A session so that more of your questions can be answered. And with that, I want to turn it over to Deborah Dokken, who will be introducing the panelists for today. Thank you.
Thank you, Marilyn. We're all delighted to be with you today and to be sharing information about how peer support might enhance care for patients and their families in practices. What I'd like to do really briefly is introduce the members of our team from the Institute for Patient and Family-Centered Care. I'm Deborah Dokken, and I'm the coordinator for patient and family partnerships at the Institute. And I work on a number of projects in that role, including currently a project looking at PFACs in New York State and the Institute's National Better Together Partnering with Families campaign. I'm also a member of our project team that is a subcontractor for PCC for the TCPI initiative. Prior to being at the Institute, I did a number of different projects, but one of them was being a founding member of the Parent Partners Group at the George Washington University Hospital, where the real centerpiece of that program was a peer support program. I'm not a clinician. My work in patient and family advocacy comes out of my own personal healthcare experiences. I'm delighted to introduce to you Joan Forte, who is a member of our team for this project. Joan has a long career in nursing, and about 20 years ago, as a nurse manager, she co-founded the Family-Centered Care Program at Packard Children's Hospital at Stanford. And then over the years, extended that program to the adult hospital at Stanford and reached the point where the program was so large that it encompassed 16 patient and family advisory councils, a patient and family faculty program, and a peer support program. Very recently, Joan served on the core research team in partnership with Johns Hopkins Medicine on a PCORI-funded project called the Roadmap for Establishing Peer Support Programs in Research and the Real World. And last but not least is Mary Minetti, who is a Senior Policy and Program Specialist at the Institute. And in that role, Mary consults with healthcare organizations and is involved in the development of resource materials. Mary serves on the TCPI PFE Affinity Circle of Champions Leadership Group, and as part of that has developed and tested the PFE performance metrics and provides technical assistance to PTNs and practices. So we are very happy as a team to share our information and expertise with you. I want to just quickly go over the objectives for today. What we'd really like to do is establish a shared understanding of peer support. What are its benefits for patients, families, and primary and ambulatory care clinicians, and what are some of the components of established or organized peer support programs? And finally, to discuss ways to integrate peer support into practices. We'll spend our time in the segments that you see listed on this slide. Mary's going to start out by setting the stage and talking about how peer support can really help with person and family engagement in TCPI. Then Joan is going to share information about peer support and best practices for peer support. And then we're going to have time to talk about resources for you, as well as time for you to pose questions via the chat box. So I'm going to turn it over to Mary now.
Great, thanks, Deborah. I wanted to just set the stage related to TCPI and how peer support can assist. And apparently my slides are not moving forward. Oh, there we go. So one of the things that we really want to talk about is that peer support, and Joan's going to talk about how to do it, how to evaluate peer support programs, but I really want to talk about how it fits into patient and family engagement. And it is primarily in the direct care realm that we're talking related to peer support. So direct care, how are we going to engage patients and families in their own care to help them identify goals and get the best health that they can? And this is kind of a continuum of patient engagement. And where we want to move over time is that we really are co-creating with our patients and families in the direct care experience what they're going to be working on, what's important to them. But most of the work that patients and families do to improve their health or maintain their health is outside of the clinical exam or office visit. And so anytime that we can improve and support people in their own self-management, we can really enhance their engagement and their connection to those important goals that they set. And there's lots of things that affect engagement, their health literacy, their sense of confidence, their ability to understand information and activities that are going to be useful to them. And often when someone is diagnosed with a new condition, that can be a very isolating experience. And so what we want to be able to do is create the opportunity to support patients outside of the office visit, and that's where peer support can come in. For those of you that have been working in the TCPI program, you're probably really familiar with these person and family engagement performance metrics. These are areas where we have in the TCPI program asked you to adopt as many of these practices to enhance patient and family engagement. What we're going to be talking about related to peer support is directly related to point of care efforts, supporting people's shared decision making and their self-management outside of once they've done the shared decision making, and how we can help them become more activated and confident patients who can increase their knowledge and their skills as it relates to managing their condition, understanding how to navigate the healthcare system, and how to manage their medications. And all those things are really important. And so how does peer support help that? Well, we want to just bring to your attention a couple of ways that peer support can really enhance your effort to really engage people on those arenas. One is peer support can increase patient and family activation, because what it does is it helps build connections with people who are like them, who have confidence and skills and knowledge and are managing their chronic conditions. And so often being able to connect with somebody who has a similar experience to you and be able to see how they've been able to navigate and build knowledge and confidence can really bolster the confidence of somebody who's newly diagnosed. Peer support can help improve somebody's health literacy. If a person hasn't navigated the healthcare system a lot, haven't interacted, and they have a new condition, often what's true is they're going to have to be interacting perhaps more than they have before in different arenas with healthcare providers. And being able to work with somebody who also has gone before them and who has had experience working and interacting more frequently with the healthcare system and can talk about ways that they've worked with the healthcare system that have been really helpful to them can help individuals who are just facing a new obstacle or a new challenge related to that. And so that, in a sense, improves their health literacy. Also, often what happens is new information is provided to somebody when they have a new condition, and that information is important to consider, but sometimes a person needs to look at that information and talk about it and take more time than perhaps is available in the office practice. So it can improve health literacy. And it also can help people understand their important role in shared decision-making and how others have interacted with their healthcare partners and how they've dealt with managing their medications. So how does that benefit the practices? We've talked about how connecting somebody with someone who also has a lived experience like them and getting peer support outside the office environment is important. Well, for the practice, it saves time because peers can answer questions, not medical questions, but questions about the lived experience and how they manage their condition. And that by getting that support from other patients, they're going to seek less support in that arena about the lived experience from providers. It's going to provide information and tips that are related to self-management that providers who don't have that condition may not have. Often when somebody's working with peer support specialists, they understand, more importantly, the treatment plan and care plans and what their role in that is. It can help improve patient outcomes. We have resources at the back that Joan will, at the end of the presentation, that actually directs you to where the evidence is. And there's evidence about the adherence to treatment plans, and there's evidence that it improves patient outcomes and improves their health when they're connected with appropriate peer support. And it helps them connect to community resources that can support them outside the office visit as they are managing a new condition. So these are really important ways that patients and families benefit by peer support. And now what I'd like to do is turn it over to Joan, who can talk about peer support and the details and content related to how you as a practice can connect to those resources and what kinds of resources are going to be most helpful to you. Joan?
Thank you, Mary. Hello, everybody. I'd like to say I'm joining you from sunny California, but it's actually not sunny in California, so I don't feel so bad. As Deborah mentioned, I have some experience with bringing up programs, and I ran a program for about 10 years, and then studying and learning from programs, but also I have used some of these peer support programs, so I'll share some of my own experiences as we talk. So just what is peer support? Well, if you have a teenager or you know any teenagers, I'm sure you're very familiar with the idea of peer pressure. It can make our kids do things they wouldn't normally do, and that's not always good. But peer support has a similar impact in the sense that it can inform us and encourage us to adopt behaviors, but in a positive and activating way. I want to refer to these two quotes you see from the Johns Hopkins study, that the thing about peer support that makes it so powerful is this common life experience and the connection with another person. Peers are just two or more people who have this lived-in experience with a similar health problem or challenge. And it could be a patient, it could be a family member, it could be a caregiver that is not related to the patient, it can even be a sibling or a child. All of those people benefit from peer-to-peer support, and there are programs available to support each of those roles. The peer supporter or mentor is just one of these people who has had personal experience with a health condition, but is trained and in some ways supervised and supported in providing support to others who experience a similar condition. Most programs have the general purposes of, as we mentioned, sharing information, enhancing emotional support, providing guidance on what works for them and how to kind of manage their daily lives, as well as connecting them with community resources. There we go. And so we mentioned a bit about what the benefits are to the provider, and we touched on what the benefits to the patient or family member are as well, but let me go into a little bit more detail. So some of the specific benefits to the mentee or the person receiving the support. So as we mentioned, it provides a lot of practical information about what it's like to live with a condition. And often peers are matched with a mentor that is further along the disease continuum. And so they also learn about what to expect, what's coming in the future for them. As we mentioned, that information isn't really available to professionals or providers that are working with patients unless they have experienced that particular disease. But on top of that, honestly, we just receive information and adapt to information better if it comes from people we perceive to be more like us. So it becomes clear that people are more likely to undertake new behaviors if they're talking to someone who's had to do the same thing. It's very motivating. And that might be services and programs that are available that others have learned about. I know that for myself, as a new parent of a developmentally disabled child, I was very eager for knowledge, and in particular to learn about what was available in my community to both support me, but also to help my child achieve her maximum potential. I had a wonderful primary care provider and pediatrician who was very supportive, but it was impossible for her to know about all of the different resources in my community for developmentally delayed children. On top of that, she had to know about the resources for all of the other disease conditions that she deals with. So I found that joining a parent support group was an ideal way for me to learn about how I could support my child through these community programs. The programs change frequently, and the parents were very up to date on what was available. So that was actually my best source of information as I tried to support my child and myself in adjusting to this new way of living. Peers can also help us learn how to navigate that complex health system. As complicated as it can be for those of us who are clinicians to manage our own health situations, it's even more complicated for those outside of systems. And we sometimes forget, because of our inside knowledge, that there are things that we know and others do not know about how to get into the systems. And so a peer can really help that newly diagnosed or that person who's struggling with their condition to figure out how best to get the help that they need through our professional systems. All of this is so relevant to how they maintain their quality of life. It certainly reduces the sense of isolation and emotional distress that people have because of that connection to others with a shared experience. The peer mentor offers encouragement and often provides hope that the outcome could be positive or manageable. It helps to validate people's feelings and experiences as being normal or at least expected. And sometimes people are reluctant to tell their providers about experiences or feelings that they're having for fear that they might be abnormal or they might be judged for those. But in talking to a peer who's had those same experiences, it's much more comfortable. Peer-to-peer gives people someone to talk about how they're feeling and someone who has, as we mentioned, the time and is willing to take the time to just listen to someone vent and talk about their experience. That gives the mentee the feeling that someone really understands, is very accessible, and can answer their questions. And when we talk to people who have benefited from peer-to-peer support, we hear them talk about the emotional satisfaction of feeling cared for, respected, heard, and understood. And it actually gives them an opportunity to even develop new relationships through these peer mentoring programs. It helps that person develop a deeper understanding and insight into their own health challenges and even the decisions that may come before them throughout the trajectory of their illness or condition. They learn new skills and learn to change their behavior because they're exposed to other ways by which people in the same situation have approached their challenges. They learn how to communicate better and how to ask questions, and that makes them better partners with their providers. We call that activation. They learn how to deal with this new reality that they have now had to accept in their health condition and how to make changes over time. They can adopt positive health behaviors because they have ongoing guidance and encouragement, kind of a cheerleader, if you will, who is always checking in and helping them along the way. And that helps them also gain confidence in their own ability to succeed in managing their disease. There are also benefits that are specific to mentors. People who mentor others find that this is a wonderful opportunity to give back. Many people who go into these programs as providers of peer support are people who have had very good experiences being supported by their providers and want to provide additional help. It gives them the opportunity to do something meaningful and to create some sense about the experience that they've had with their disease. Sharing their own experiences can also be very therapeutic and help them feel stronger and more confident of their skills. So there are many ways that these programs can be delivered. When we look at a few of the models that are highly successful, we see different formats. Group support is a common one. And in group support, the facilitator is the one who initiates and guides the discussion. But they also encourage the group members to continue the conversation and bring up their own topics of interest. One of the real benefits to having a group is that you get an exposure to many other people who are experiencing the disease or have experienced the condition. And so they're able to encourage each other, troubleshoot problems together, and learn from each other. They also see that they are not alone with the condition that they're trying to manage. And these more structured sessions can allow the facilitator to keep the group very focused, positive, and oriented towards determining solutions. One-on-one support is where the topic of discussion is really driven by the peer who is receiving the support, by the program participant. It offers more flexibility because the conversation is occurring between just two individuals. And because of that also, it can provide a deeper, more focused understanding of that individual's needs. Sometimes participants say they feel the ability to speak more freely because they are only interacting with one individual and that they can ask their specific questions without feeling like they are taking over the group. Of course, there are also many virtual support methodologies, either through online communities or through phone. And those can be especially useful in certain conditions and situations. For example, when it's a rare condition and geographical proximity is difficult, or perhaps a clinical condition like cystic fibrosis where peers cannot actually be in the same room, or maybe in a situation where the person who is seeking peer support cannot leave their home because of their condition or other reasons. And people who are seeking peer support may choose one of these that they're more comfortable with, or they may use a variety of them. Again, in my experience seeking peer support, when my husband died suddenly, I tried going to a peer support group, but I found that taking in the incredible pain that others were experiencing along with my own pain was just too overwhelming. So unlike the situation when I had a disabled child, when I was seeking groups, in this particular situation, I found that one-on-one support met my needs much better because I could deal with just one person and one person's experience in addition to my own. These kinds of support take place in a variety of settings as well. And as Mary mentioned, we'll talk about some of the national organizations that you can use to refer your patients to, but we want to also encourage you to look into your own community because there are many very good community-based organizations. And checking with hospitals and clinics in your area can also be a wealth of support opportunities. I want to stop for a moment just to clarify one thing that is a common misunderstanding. We mentioned earlier the topic of patient and family advisory councils, or PFACs, which are becoming very common vehicles to work with patients and families and organizations. But I want to clarify that these are not peer support groups. Often people think that that is one of their purposes. But these groups have very different goals and structures and are really designed to be consumer teams that work with providers and staff in an organization to advise, advocate, and partner with them to improve care, maybe to identify gaps in care, and to work to co-design solutions and evaluate change processes. I also want to acknowledge that lots of providers understand and believe in the value of peer-to-peer support and may decide to informally connect patients in their practice. And that could bring up some issues that I want to caution folks about. If we are referring to individuals who do not have programmatic support, we can get into situations. Perhaps the mentor who is asked by their physician to help support another patient doesn't feel comfortable saying no. They don't want to disrupt their relationship with their provider. They don't want to disappoint the provider. So they may agree to do something that they really don't want to do. They don't receive any training on responding to what can be very intense needs from the newly diagnosed patient. They also do not receive any support. And one thing that happens commonly when peers support one another is they can become triggered by what the new person is going through. And that can bring back memories that are difficult to manage of their own experiences. The mentor can also become overwhelmed. We've had experiences where sometimes the mentor is supporting someone who begins to do less well or even dies. And because of the connection, it can be very difficult for that mentor to cope without a form of support. Sometimes the mentor just wants out of a relationship that isn't working very well for them, and that can be difficult without the support of a program. Sometimes we run across HIPAA and privacy concerns when this informal peer-to-peer mentoring takes place. We can also see that people without training may overstep their boundaries and provide medical advice, and all of these put the provider at risk for litigation. So we strongly recommend that you encourage your providers to utilize these programs that have put into place certain safety and quality controls to make sure that referring people to one another is good for both parties and safe for the provider. What are some of the criteria that we look at when we think about making sure that a program is strong and can provide the resources that the patient and family needs? Well, first of all, consider program design. So there are many diverse ways of structuring a program. Personnel can include volunteers. It might include paraprofessionals who've been certified in something such as recovery. And it usually also includes healthcare providers such as nurses or social workers. One element is that the peers are carefully selected and trained, not just identified because they're friendly or good communicators, but because they have other qualifications that help them to be good mentors. Supervision is one of the most key pieces to assuring that a program is high quality and safe for all involved. With supervision, there's an open dialogue with a supervisor or program coordinator, and usually regular meetings. One-on-one counseling is provided to the mentor to make sure that they can process what they're taking in, and also to gain skills in supporting their mentee. They usually have an opportunity to share their experience with other mentors and learn from others. And it's very important that that mentor has 24/7 availability of support and supervision should difficult situations arise. These things are not present in an informal program. Matching is also important and requires that the program be very familiar with the mentors and their characteristics, and also really understand what the mentee or the new participant's needs are and their characteristics. Different things are used for matching. It might be the health condition, but often has other pieces that are important, such as their place in the illness trajectory, their life situation, perhaps their age, geographic location, or even special circumstances of the person seeking support. We also manage the number of matches per mentor carefully so that that person does not become overburdened. And the last two pieces are also critical. We need to make sure that a program is collecting data so that we can be evaluating the program and making sure that it's meeting their objectives in an efficient and effective way. Most of these programs collect two different kinds of metrics, process metrics as well as outcome metrics. So process metrics might include things like the number of clients served, what topics are discussed, how well the mentor is performing. Outcome metrics are things like how satisfied the clients are, as well as some of the specific and measurable improvements in quality of life, such as rehospitalization, the ones that are very important to us as clinicians. They also take into account the feedback from the clinicians who are referring to their programs. So the providers also have a voice in shaping these programs and making sure that they're of high quality. Okay, trying to advance here. There we go. Also, I think key to the success of these programs is very clear understanding of the different roles in supporting patients and families. And so on this little slide, you can see a schematic that very simply represents the two essential roles in supporting people and the ways in which they provide that support. So for the peer mentor or supporter, that support comes from their own experience. That knowledge of how to support that person comes from their experience. And what they're primarily providing is an emotional and psychosocial support because of that experience. Whereas the professional gains their knowledge from education and training and experience in caring for people. And they might provide support through a variety of ways and skill sets that they've learned through their training. So we know that these professional and peer care are both complementary and equally important, but they are different. And sometimes the support and assistance from the healthcare professional is not the right kind to meet those informational, emotional, and support needs of patients and families. This can actually become a burden for the provider because as the patient and the family member continue to try to seek that support, they may attempt to seek that support from the professional who does not have the knowledge from personal experience to meet the need. Medical services may not touch upon the experiences of the patient and family member, and so mentees seek out programs like peer support for information about resources and also to become part of a community that helps support them and give them hope. Peer mentees consistently say that medical services are important, but peer support services provide what professionals don't, that information and resources to manage and live with the illness on a daily basis to help decrease their social isolation and the feeling of being alone, and also even to help them build friendship. One of the most critical pieces, I think, about assuring the quality of a program is making sure that the training that the mentors receive is strong. And I think that programs that have strong quality and safety controls do training in all of the aspects that you see on this slide, as well as others. They offer very detailed and specific training, often by clinical experts in the field. They use role play and practice of techniques and discussions on critical topics like maintaining emotional and temporal boundaries, being mindful of the role as peer supporter and not being a healthcare provider, and making sure that they're not sharing their own stressors and leaning on the mentee to support them. These are all things we see commonly in folks that do not have training about providing support. They also learn how to watch for some serious concerns that can come up in a relationship. Things like destructive behavior or behaviors that are a danger of self to others. Sometimes, as we all know, when people are encountering a new health challenge, they can feel very depressed and even suicidal and express that to their peers. They may have other mental health concerns that come up or red flags. And these training programs teach that peer mentor what to do and who to contact for more support if they see those things in their mentees. Some programs, and this comes from one of the programs we studied with the Johns Hopkins PCORI grant, have very clear core competencies that they deliver through their programs and assure that their peer mentors are strong in. Those mentors must learn and possess these competencies, and they're met through initial training, but also follow-up education and support activities that are ongoing to make sure that the mentor continues to be competent and continues to grow their skills. In addition to helping acquire these competencies, preparation of peer mentors includes education on common topics related to the health condition that they're addressing or the population that's being served. They also get orientation to their role within their respective organization, which usually includes relevant policies, documentation, the paperwork involved, how they collect data to feed into the evaluation process. They learn how to collaborate with the healthcare professionals that are referring patients to them and how to work with primary care practices as well as specialists. And of course, they receive training on HIPAA and other regulatory requirements that are essential for people that work in healthcare settings. So all of these things are important as we learn about how to take care of other people. These are the things that tell us that a program is strong. But how can you then, as a provider, bring this valuable and unique resource to your patients? Well, the first thing is to make sure that you have a good understanding of what peer mentorship is and how the benefits can be attained by your patients and family members. And hopefully our conversation this morning has helped increase your knowledge. The second piece is just to be ready and willing to utilize peer support in your practice. And so building it into your regular patient visits and your assessments, maybe coming up with a few questions that you can use to explore the concept of peer support with your patients. For example, you might say, some patients find it helpful to talk to someone who has the same condition or disease that they have. Is that something you might be interested in? There's some easy conversation openers that you can have in your back pocket to make sure that you're always offering that free and important resource to your patients and families. And then be aware of what the national peer support programs are that may have chapters or affiliates in your community or region. And we'll talk about a few of those that we recommend to you. And finally, I would say to you, to not make any assumptions. Sometimes we think that the people that will benefit most from peer support are those that seem less educated or less connected in their communities. But I want to read you a quote that we came across in our studies of peer-to-peer programs across the country. This individual says, I have specific needs. I'm actually a doctoral level clinical psychologist, so I felt pretty confident about understanding the disease state and understanding the coping portion. The support piece that I needed was that I'm in a new city. I don't know the network, and I need to find out. I need a full community to support me. So we want to share some resources for you and ways in which you can help to build that community of support for your patients and families. On this slide, you see a couple of websites that contain a variety of information, articles, and tools that can really help expand your knowledge. And so we encourage you to take a look at them. They'll also help you use this resource in helping your patients and families. We include here some of the national programs that offer peer support. And we've tried to provide a variety that will address some of the more common conditions and situations that you see. Mental health, asthma, cancer, cardiovascular disease, children diagnosed with special needs, diabetes, grief and loss, mental illness, and an online community that addresses a variety of diseases, including rare diseases where it may be difficult to connect someone in their own community. All of these programs meet those safety and quality criteria that we've talked about. They have strong structures and program designs. They do extensive training. They provide support and supervision to their mentors. They do strong evaluation based on data collection, and they have lots of other quality controls in place. We also include here a few articles. As Mary indicated earlier in our hour together, the evidence is rich to support the value of this free support for patients and families. And the research has been done in many different disease and health conditions. We know that there are many, many articles out there that support the different benefits that your patients and families can accomplish through peer-to-peer support. The value to patients and families, as we indicated, is not just in the psychosocial realm, but also in clinical outcome and quality of life. We see increases in adherence to medication and specific diet recommendations, increases in exercise, decreases in harmful behaviors such as smoking, better utilization of health services that is more appropriate. All of these are documented in research, so we encourage you to take a look at some of the articles. Thank you all so much for your attention today to this important topic and resource, which we believe will really improve the patient and family-centered care components of your practices. I'm going to turn it back to Mary now because we're happy to hear your comments and any questions that you might have. Thank you so much.
And thank you, Joan, for a very comprehensive and thorough review of what is important about peer support, but what's also important for practitioners as they're getting ready to refer patients for peer support to consider as they're involving them. So we're going to be open for questions and answers, but I have a couple questions now, and I encourage people to go to the questions section of the control panel to chat in any additional questions. But Deborah, I wanted to ask you, let me just move my cursor. Now you all know visually that we're going to be taking questions. Deborah, I wanted to ask you to share with us, if you would. Joan did a nice job of sharing how she experienced peer support as both the mother, as a mother and as a wife in different situations. I know that you've had experience receiving peer support. When you think about that, can you think about not only what was the experience like as you were working with your mentor, but what did your practice do to help you feel connected, to help make that bridge to peer support?
Mary, I thank you for asking. I actually had two personal experiences with peer support. One as the parent of babies who had been in the NICU, and the other, like Joan, as a bereaved spouse. And I think the main thing that I would say about peer support, and I think Joan also mentioned it, but so often being in my two situations, being the parent not just of a NICU baby, but ultimately a baby who was in the NICU who did not survive, it's very isolating in the sense that all the people who were your friends before can't necessarily ride out that journey with you. And the same thing was true in my case, being a bereaved spouse. And it's almost something you don't expect, that you will really lose a large percentage of the people that you spent time with. A lot of your friends just can't go there with you. So peer support, especially I think in group settings, can really help you in a time where you are literally alone and isolated. When you asked about referrals to peer support, with the NICU peer support, the referral for me in that case came from the NICU staff, had been involved in developing the peer support program. So they made the information about the availability of peer support known to parents, but it was in a very gentle, low-key way as you were just in the NICU. With my referral to bereavement support, it actually came through, it did come through a primary care physician who knew about both individual support for bereavement, but also about some peer support programs through local organizations.
Great. Thank you, Deborah. Joan, you shared on a slide the national resources for a number of conditions where people can connect to a national service. Can you comment at all about the availability of peer support in local communities? Are there some things that people should be aware of, some practices should be aware of that they could do in their local community to find out what might be available? Are there places where often peer support is developed?
Absolutely. So I think the first thing I would say would be to check with local hospitals and clinics. Many hospitals now are bringing up their own programs. We're getting lots of requests to help support people as the evidence mounts that it has such benefit to patients and families as well as to providers. We're seeing a demand to create these programs. So the program may be small, but it may be available. And you can often find that out just by looking at the website for the hospital or clinic, because that's one of the primary ways they inform the community about the program. If they don't have a program, they also may just be aware of what else is in the community. But, interestingly enough, the way that people often find out about programs is, going to that all-powerful source of truth, the internet, and just Googling, peer support programs in a local area. Now, as we mentioned, I would certainly recommend that rather than just directly refer, that the provider does a little investigating into the program and make sure that it meets some of those standards we talked about. But that's a very good way. The other thing that I would mention is that, kind of along Deborah and my experiences, sometimes it is the patient who knows about other programs. So while we don't recommend that providers ask their patients to support each other, you certainly can talk to some of your patients who've been dealing with an illness or a condition for a while and ask them if they're aware. And finally, I would suggest that there are many national organizations that are disease specific. And while they may not have a branch or a service in your area, they also may be able to refer to more local organizations. So those are a couple ways that you can find some of the programs that may not be as highly advertised.
Great.
Mary, this is Deborah. I had one thing to add on.
Mm-hmm.
I think it's interesting to note with peer support in the national programs that they are now, like everything else in our society, and I mean this in a positive way, really taking advantage of technology. So many of the national programs that are included on the resource list, the peer support is virtual through, protected mechanisms, certainly, but it's like everything else in our society that technology can be a wonderful, supportive mechanism to make this happen more readily, because it is hard to have an organized program in, every geographic area.
Yeah. But it sounds like we would want, as Joan said, to consider that any virtual peer support effort also meets the criteria of the gold standard, so that whether it's virtual or it's face-to-face, whether it's individual or it's group, that the ability to have training, to have supervision is critically important. Would you agree, Joan?
Absolutely. I would add to that. I know, we include in our references one resource that is primarily online, and I would want to make sure that these opportunities are ones that are monitored. So the really good programs do provide monitoring. They're not just chat rooms that are open to everyone and all content, because that can be problematic as well.
Great.
I want to add one more point, Mary, too, if I might, that I didn't highlight earlier. And that is, you know, we think often, I think, when we have a newly diagnosed patient about how to provide support. But I want to also point out that there are other times when a patient or family member might really benefit from peer support, certainly if there's an exacerbation of disease. But also sometimes we have life changes that aren't directly related to our disease, but because our disease is all-encompassing, are impacted by it. So for example, you know, a young person that maybe has a baby and now has to cope with their disease as well as raising a child. Or as we mentioned earlier too, relocating to a different community. There's lots of life changes that also are places where people can really benefit from talking to somebody who's been through a similar situation. So I just want to remind people that not to just think about their new patients, but really all of their patients at some point in their care would probably benefit from this service.
Wonderful. And that's a great reminder, Joan. And I noticed that we have a comment from Janice Tufte, and she's just mentioning that they have an excellent peer support program at Seattle Mental Health, Senior Horizons program, Art with Alzheimer's, and many more. And so, so I think it's good to, it just reinforces that there are people in the community who are well connected with the community, and that practices can ask individuals what their knowledge is and those kinds of things. I want to be sensitive to the time. I thank people for their questions, and Janice for your comment, and for the responses from Deborah and Joan. I want to just for a moment remind you that you have as a handout a brochure around peer support, its value, some resources that is able to be printed on 2 sides and be a 1-page document that you may find handy for your practices. So I wanted to bring that to your attention. And then, Jacinta, I seem to be stuck on my slides. Oh, there we go. So one of the things we wanted you to be aware of is we are launching a pilot for the states of Connecticut, Indiana, and Wisconsin to assist and facilitate practices, primary care or other ambulatory practices who want to engage and support their families, want to connect to peer support resources that meet the criteria that Joan was outlining and become a pilot practice. We're going to provide implementation support and make it easy and efficient, which often is what practices are most concerned about. And so this is a parent-to-parent resources, path-to-path. Family Voices of Connecticut is one of the parent resources that we are looking to connect practices with. There's Ask About Special Kids in Indiana and Parent-to-Parent of Wisconsin. These are well-respected peer support resources for parents. And again, Joan's comment about the life changes, it isn't just for new parents with new kids that have health challenges, but at life changes as well. So if you are interested, if you're in Connecticut, Indiana, or Wisconsin, and you want to hear more about these pilots and how we can help connect you to this particular parent-to-parent resource in your geographic area, please send me an email and I will help facilitate that. We are also, and Jacinta, again, my slides aren't moving, so if you can move to the next slide. I also want to let people know that connecting with other people and getting ideas is as easy as joining the free online learning community that we host at IPFCC called PFCC Connect. It's free. It helps connect patient and family advisors with clinicians, with other healthcare professionals to improve and transform care across all settings. And we have an ambulatory and primary care special topic group for TCPI practices. We encourage patient and family advisors to connect with other advisors. And together we're all in this in terms of the transformation. And there are lots of interesting discussions that happen and resources that are shared. So we encourage you to go there. Jacinta, can you move to the next slide, please? And then I don't want to, if you haven't spent any time out at Patient-Centered Primary Care Collaborative, TCPI, SAN, space. I really encourage you to go out there. There are additional resources. This webinar, of course, will be loaded there, but there are other short webinars, there are short videos, there's tools for patients and caregivers, for clinicians and the care team on all of the TCPI metrics and other important items that will help you transform care in the TCPI practices. And so spend some time out there. I want to thank you all for spending time with us today, and I want to, for the wrap-up, hand it over to Marilyn from PCPCC.
Hi. Hello. Can you hear me?
I can.
Yep. Oh, okay, great. Well, thank you so much for everybody who joined us today, and thank you so much for our speakers. They really provided a lot of valuable information. And I just wanted to remind you that we will be sending out a tape of the webinar to people who have joined us today, and it will also be available on the PCPCC website. And again, my name is Marilyn Francis, and I'm the program director for PCPCC, and then also my colleague, Jacinta Smith. Please feel free to contact us if you have any questions or want to talk through anything further. We are happy to speak with you. So again, thank you very much, and I hope you enjoy the rest of your afternoon. Thank you.
Take care, everyone. Bye.
Thank you all.